Hey everyone, it's Dr. Schoemann at Plastic Surgery. Today we're going to be talking all things facelift, and there's a lot of stuff on the internet about the different techniques out there, deep plane facelift versus a high SMAS facelift. Today I'm going to be talking about the differences and my preferred technique, and we have our lovely model Joanne who's going to help demonstrate everything. This area of the face back here is very fixed, and we call this the fixed SMAS layer. This doesn't really move very much. So if you look at someone's face, they tend to age here towards the middle, mainly because this area has to be very mobile so we can be very expressive. This side of the face is very fixed, and as we age, this center portion of the face starts to descend. And so for facelifting, we're not just addressing loose skin and tightening that, we're actually tightening the deep layer. So for a deep plane facelift, I enter underneath that muscle layer here and get to the area that's mobile and move it back to where it used to be and fixate it to this fixed area with sutures. The difference between that and what's called a high SMAS facelift, which is sort of the traditional facelift that's been around for a while, you enter back here by the ear and you go under this fixed area and you tug on that to pull up closer and then moving it back to where it used to be. I think the deep plane facelift also gives a much more natural result, and I have to say that is the #1 concern patients have coming in for a facelift is they don't want to look weird. Facelifting done 20 years ago was very aggressive, and they were doing a lot of tugging back here, and people had a very unnatural looking result. My patients prefer a much more natural looking result. They want to turn back the clock, and my preference is to move the tissue that's fallen and put it back where it used to be. Basically, we're restoring the face to what it looked like maybe 10 years ago. If you're thinking about a deep plane facelift, I'd recommend obviously going to someone who's board certified, whether that's an ENT surgeon or a plastic surgeon. So a lot of patients are concerned about recovery after a facelift. Sometimes we do combine it with CO2 laser to resurface the skin and improve the quality of the skin. That'll add a little bit more recovery time as far as healing goes. After about 10 days, all the stitches are out. There's usually a little residual swelling along the jawline and the neck and some bruising. So you're looking at about 2 to 3 weeks before you can go out with nosy friends. And I get this question a lot from patients, and that is, who's a candidate for a facelift? A lot of it depends on their genetics and how they age and how their facial anatomy is, as well as volume loss. If you're considering a deep plane facelift with some ancillary procedures, please come see us at Plastic Surgery. We have a quad ASF certified operating suite on site, and we'd be happy to help you with any of your concerns.